representative and asked me to do some research on that. And we have done some preliminary research on it, and it so far looks like a good deal. We're still trying to make sure it's not too good to be true. What I have confirmed is that it is a prescription drug card program provided through NACO. It's a negotiations that NACO has done with a corporation called Caremark, and that relationship has allowed for Caremark to provide this card. It's a drug discount card to citizens of all counties in the United States who do not have prescription drug coverage. That is the purpose of the card. It's for those who do not have coverage. It is also for those who have a prescription that may not be covered by their current prescription carrier. So it can be utilized in many ways. What this card provides is a 20% discount of the cost of that prescription that would not be covered under an existing prescription drug program, or for a citizen who does not have a prescription drug coverage at all. Currently, the counties in California that are participating in the program already are Alpine County, Lake County, Mariposa County, Merced County, Nevada County, Plumas County, Shasta County, Sutter County. I'm currently in communication with the Human Resources Director for Sonoma County. They are also looking at this program for implementation in their county. The pharmacies in our area who are already contracted with Caremark and who are already up and running and ready to provide the 20% discount to citizens of our county is Long's of Ukiah, Myers Apothecary, Rayleigh's, Rite Aid, Safeway, Blue Drug, Walmart, Walgreens, Myers Medical Pharmacy, North Lake Medical Pharmacy, Kmart, Long's in Lakeport, and then also North Lake, another location of North Lake Medical Pharmacy in Lakeport. So we already have those pharmacies on board who are willing to accept this card. What I'm looking for from the board today is permission to move forward with the implementation of this program in Mendocino County. I will be working with the Health and Human Services Agency for distribution. We will bring this before you once we do have the contract finalized and approved by the CEO's office, and we will do a full presentation of what the program has to offer and provide information to our community. In participating in this program, NACO provides us with the materials to do this communication to the public and to the citizens, and we will be building a web page. It's all to no cost to the county. The templates are already provided by NACO. It's a package that's already in place. We simply have to implement.
Thank you. As the person that brought this forward, this is a program that is too good to be true, but it is true. It provides an outright discount of 20% for the uninsured and for people that are insured but maybe are assigned prescriptions that are not covered by their prescriber. This program itself, the savings that would it provide to the citizens of Mendocino County, more than pay for all the trips of the NACO representative and the alternate representative in any given year, I think. This is what sending people to Washington and the various states for NACO meetings, these contacts are what save the people money. And this is an absolute program that will save everybody money. First Five with health care for all, farm workers, seniors, myself that might get a prescription that's not covered by your prescriber. This saves money, and it, for once, really is something that is too good to be true because it is true. So I would be shocked if a unanimous approval vote doesn't come forward on this item. But certainly, being a diverse group that we are, I guess it wouldn't surprise me if there was some discontent or concern over it. But I would certainly request a unanimous approval for such a program that would cover such a wide range of income, background, availabilities to the citizens of our county. So I believe Supervisor Delbar was first.
So does that mean you're in favor of it? Obviously, it's anything we can do to pass on or make available to our citizenry a discount, particularly those with fixed incomes, is tremendous. And I have not heard anything negative about the program from those who are using it. So I would make the motion, the recommended motion.
I'll second, Mr. Chairman.
Okay, there is a motion, a second, and a comment from Supervisor Pinches.
I'm sure this is going to pass unanimously. This is huge for this county. I mean, it's really good news. Only one thing I think we need to do is we need to get the word out there, and once this is implemented, get it advertised.
We will.
You know, everybody has to know, about this. I'll do what I can do to spread the word, but yeah, when will this be in effect?
Once the CEO's once the approval is provided by the board today and the CEO and county council in concurrence on the contract, once it's signed, it takes 6 weeks for implementation. In that 6-week period, I will receive the cards, I will receive the advertisement materials, and we'll receive the assistance from NACO to get the website up and running, and then during that 6 weeks, I will also be working with the Health and Human Services Agency for assistance and distribution. But so within 6 weeks, we can have this up and running.
Great.
If I can make one more comment, in speaking with the executive director of marketing involved in this NACO communication piece, there are currently 1,000 counties in the United States who participate in this program today.
And that is out of the 3,318 counties total in the United States.
I didn't know that number.
This is a rapidly growing program. The hesitancy has been exactly what we talked about. This is a program too good to be true. So we're not the only ones saying, okay, this looks great, but we need to examine it a little bit further. So, Supervisor Smith?
Thank you. Yeah, I think the hesitancy isn't warranted. I think we have to do anything that we can to alleviate the cost to citizens that don't have health care in one form or another, either ones that they're getting through the state or ones provided by their employers or ones that they're paying for. But I think in reality, this is truly another one of the Band-Aids that we have to apply until we get a handle on this at the federal level in terms of capping costs for prescription drugs. This is sort of what we're faced with. A 20% reduction in a $200 bill is significant, but the real issue here is what are the fees that are being passed on to citizens. When the same prescription drugs can be obtained in Europe for a fraction, literally a fraction, maybe 10 to 12 or 15% of what we're paying for them here, something's seriously wrong. So we need to get that prescription drug benefit for seniors that unfortunately we didn't get in the last round with who we have in Washington, and we need to get it, and we need to get it done right. We need to get that kind of a benefit passed on to citizens in some form of national universal health coverage. And until we do that, this is really going to be a Band-Aid. And I think we're going to need to look at the fine print at the bottom that talks about, on occasion, pharmacies will price a particular medication lower than the discount rate available to the NACO card. Sure, there are discount pharmacies everywhere. So I don't think this card is probably going to do one much good if you're already going to a discounted pharmacy. If, in other words, if you've been proactive in advocating for yourself and checking out your least available cost. But absolutely, for the senior that lives in this county that can't access a discounted rate, someone that doesn't have another ability to pay for it, we should do everything we can. So I think we need to support it. I think it would be good if it doesn't entail a lot of staff time to see, can we really demonstrate the savings as we go forward. So I don't know if that's something you're going to be in a position to do or not.